I welcome you all to the new episode of Dr. Sin. Today we are going to discuss about renal transplantation, and we have with us Dr. S. Vasudevan, who is the additional professor of urology in Medical College, Trivandrum. Welcome, doctor.
Thank you.
Firstly, we would like to know more about you.
I graduated in medicine from Trivandrum Medical College in 1984. I did my surgical studies from Trivandrum Medical College. Later, I qualified in urology from Calicut Medical College, and I have worked in Trivandrum Medical College, Thrissur Medical College, and Calicut Medical College. Right now, my areas of special interest are renal transplantation, oncology or work related to urologic cancers, and surgery related to stone disease.
Can you tell us the relevance of transplantation today?
The number of patients who are facing terminal renal disease is on the increase. A rough estimate is that about 1.5 to 2 lakh patients are right now on treatment for renal disease and needing definitive treatment as they have reached the end stage renal disease. The present day statistics reveal that only about 5,000 of these patients have access to renal transplantation every year. So that shows the gap that is existing between the amount of people who need renal transplantation and the number of patients who are actually getting that procedure done. So that is the relevance of activities to promote the number of renal transplantations being done every year. This is the scenario all over the world. Even in advanced countries like United States, roughly about 25,000 procedures are done every year. So there is need to address this gap between supply and demand. That is the relevance of activities which promote renal transplantation today. Regarding the causative factors that lead to renal failure, we can divide them into conditions which appear in childhood, like infective processes, glomerulonephritis, pyelonephritis, nephrotic syndrome are some of those diseases. Same diseases can come in adulthood. In addition, patients who have chronic degenerative diseases like diabetes, hypertension, then SLE, periarteritis nodosa, then some certain congenital diseases which appear in any age like polycystic disease of the kidney. These are all some of the diseases that cause renal failure. Among them, if you take the percentage of patients who have diabetic nephropathy, that is the renal disease that appears probably about 8 to 10 years after a patient has been diagnosed with diabetes mellitus, is probably the one which is increasing at a rapid pace. We all know that India is now the diabetic capital of the world, and Kerala has also the maximum number of patients if you take state-wise. So combining all this, the relevance of measures to treat renal failure will be evident. So a lot needs to be done in this area in the near future if we are to be able to treat at least a good number of these patients.
Okay, in what age group is this disease more seen?
Actually, all age group of population are susceptible to this disease. So in some where the disease attacks in young age, they may go on to renal failure in their teens. Those patients who get degenerative diseases are susceptible to this disease in their 40s or 50s. So no age is free from this disease. It is an universal problem.
So, what are the treatments given for such patients?
Once diagnosed, the initial measures would be to limit the progression of the disease. That is, through a combination of dietetic measures, medical measures to reduce the progress of the disease and regular follow-up tests. Patients should be guided through the natural history of the disease so that they don't reach terminal or end-stage renal disease very fast. This is very successful if they undergo a timed follow-up as well as evaluation procedures. But once the renal failure reaches terminal phases, that is stage 5, they have to be treated more aggressively. So at that stage, their options before a patient is either undergo dialysis or undergo renal transplantation. Dialysis can be done either through the blood vessels, that is hemodialysis, or it can be done through the peritoneal membrane, that is peritoneal dialysis. But it should be understood that at best, dialysis is only a means of life saving. It can never give good quality of life to a patient, which is comparable to that which a patient gets after they undergo renal transplantation. Even cost-wise, it is much more cheaper in the long run for a patient to undergo transplantation. Also, the patient will not need not stay close to the hospital. He will have a better quality of life and will be able to undertake many activities which he will not be able to undertake if he is still on dialysis. That is the relevance of promoting renal transplantation among patients with end-stage renal disease.
Can this lead to death?
Of course, a patient in end-stage renal disease who is not treated promptly or incompletely treated or who refuses to undergo the treatment protocol, they are all in risk of having complications. Among the complications would be a severe pulmonary edema at which a patient is in risk for death. So of course, as I said, there is a large gap between supply and demand. So a lot of patients don't get access to the definitive modes of treatment, and it is presumed that all these patients who don't get access to good health care will surely get the terminal complications and will face early death.
Okay, what is the time duration for this type of treatment?
Often dialysis will have to be done at least 2 to 3 times a week, which means alternate days they have to be in the hospital to undergo dialysis. Each dialysis procedure may last 2 to 3 hours in an average. So this gives us the amount of time a patient will have to set apart for treatment if they undergo a dialysis protocol. Whereas a renal transplantation, patient will have to undergo extensive evaluation, and once a successful procedure is done, he will have to be in close follow-up for the first month and probably at timed intervals for follow-up later on. But that will have to be lifelong because the complications which a patient may have post-transplantation are numerous, but most of them can be detected by regular follow-up and evaluation.
What is renal transplantation?
As a procedure, in simple terms, it amounts to harvesting a kidney in all its good forms from a donor, who can either be live or facing imminent death, and placing this kidney into a recipient by a simultaneous procedure of operative surgery. So as the procedure means, the stress would be on getting the ideal person as a donor for giving the kidney. Here donors should be sourced from either live donors or patients who face imminent death due to some other reason like trauma or cerebrovascular disease. This set of patients are called deceased donor or cadaver transplants. Among live donors, we would have either related, where the donor would be a close blood relation of the recipient. In case of unrelated donor, they would have to undergo evaluation and would have to go through a committee which would consist of a forensic medicine expert, neurosurgeon, and also a psychiatrist to know whether they are donating out of free will or whether they have some other motives in mind. So this would afford legal protection to the team which performs the transplantation. Also, in recent days, there is a chain of donation whereby it has all come in the press, where well-meaning individuals would come forward to donate. Also, sometimes if the patient is a male, he's unmarried, his wife might donate to another person, whereas this wife of the second patient might donate to a third person, and thus the chain goes along. So this sort of donation is also nowadays being observed in several places, where good meaning individuals would donate kidneys to patients who need. So these are the sort of options which are available as far as a donor is concerned.
What is the source of donation?
It can either be a live donor, which could be related or unrelated, and also from a imminent patient facing imminent death. Here again, a donor is selected who is the same blood group as that of a recipient. Also, by cross matching, we could get blood groups which are compatible. But in recent days, there is also a trend to undergo donations across incompatible groups. So that also would be selected by a process of cross matching of the antigen systems. Nowadays, there is another trend whereby we said earlier about cadaver transplantation. There, it is a brain dead patient who donates. A patient who has become brain dead due to some other reason like severe road trauma, where a patient cannot be saved but on ventilator and life support systems, or another patient who has undergone a severe cerebrovascular accident like a stroke, and we are not able to save the patient but he is still brain dead. So these patients, after examination by a team of neurologists or neurosurgeons, they could be certified as brain dead, and giving sufficient time, and if the patient's bystanders or close relatives are willing to provide donation of vital organs, here harvesting of kidneys, liver, eye, heart, lungs, pancreas, blood vessels, all these are possible, even the skin. So up to 18 organs could be harvested from any patient who is facing imminent death and whose relatives are willing for donation, organ donation. So that is the concept of organ donation in a imminent dead or brain dead patient. And this program is called Mrida Sanjeevani, and it is also called the Kerala Network for Organ Sharing, or KNOS. And it is this framework that has popularized the concept of brain dead and cadaver organ donation. We see most of the patients undergoing end-stage renal disease and approaching a renal transplantation run helplessly in search of a donor. So for them, this program is definitely a big boon. So all efforts to promote this program have to be done.
So, doctor, coming back to renal transplantation, what is the actual cost for this treatment?
The cost has to be seen in two headings. First would be the cost to evaluate a potential donor as well as a recipient, and the cost of undergoing the procedure. The second part would be for a patient who has undergone renal transplantation to maintain himself in the form of repeated evaluations as well as drugs to prevent rejection, that is immunosuppressive drugs. These drugs cost a lot and this has to be given lifelong. So a cost of the procedure has to be seen in both these headings. In the first heading, in a good hospital, we could expect cost to be somewhere around maybe over 1 lakh to approximately about 5 lakhs. This cost has been a major deterrent to all families who are anticipating this procedure. If a patient plans his procedure sufficiently early, there is sufficiently help available from the community as well as the government for them to be helped through this procedure. And there are schemes in some other states whereby these medicines are made available after the transplant. Even in Kerala, there is this Karunya pharmacies who make available these drugs at low cost, whereby it is affordable more than previously.
What advice you would like to give the patients who have undergone this renal transplantation?
For those patients who have undergone this procedure, they should look after themselves with equal attention further in life, because there are several complications that could come to these patients over years. Infection is one big problem. They could get viral infections, bacterial infections, as well as protozoal infections, and they need to be constantly on the guard to detect these infections early and treat them. Second is to guard against cancers. Many of these patients long term are at risk for cancers because of the immunosuppression they are undergoing. And this also requires regular, timely visits and evaluation. Lastly, the disease could recur in many patients, either in the graft or because of improper attention to follow-up. So, they require modification of their drugs of immunosuppressants constantly. So, they have to be regularly in touch with the operating team as well as nephrologists. Actually, there should also be a set of advice to the public. The danger of lifestyle diseases damaging any vital organ is very much there. So, similarly, kidneys could also be affected. So, adopt a healthy lifestyle, attention to what you eat, how you exercise, and how you search for diseases at each stage of life, so that early detection is available and any problem could be treated sufficiently early to prevent end organ damage, which necessitates this sort of end-stage treatment.
Okay, doctor, thanks a lot for being a part of our program.
Thank you. I too enjoyed your program.
So, that was Dr. S. Vasudevan with us. Until we meet next time, this is me, Naina, signing off. Take care.